Hi everyone, thank you so much for joining us today. We're here with Village Pediatrics. We decided to do a subject which Jessica and I get asked about all the time, which is, what do we ask the pediatrician? What sort of questions should we ask to make sure that we're choosing the right doctor for our child? Especially if you're a first-time mum, it's such a nerve-wracking thing choosing your pediatrician. You really want to make sure you choose the best person for your baby. So that was the idea behind today. So off you go, ladies.
I'm Dr. Nikki Gorman, and Jen and I started Village Pediatrics together almost 10 years ago, and together we practiced for that for 4 years before then. So, and we're right in Westport.
And Dr. Jen Groon, we go by Dr. Nikki, Dr. Jen, makes it a little easier since we're both G's. And we obviously get this question a lot from patients. We do prenatals, and parents will come in and have a couple little questions to ask, and then they sort of look and say, what am I supposed to be asking you?
Right.
I don't know what I don't know. And we generally will cover a couple of basic areas that I think are the most important when you're looking for a physician. One of them is you want to feel like you just have a nice back and forth with a pediatrician. You want to feel like you can call them or contact them if you've got any concerns, because as a first-time parent, it's a very steep learning curve, and you're going to feel like you have a lot of important questions and a lot of sillier questions as well. You want to make sure you feel like, okay, I can contact them and ask, is it normal for my baby's poop to be purple or orange or...
If it's not red, black, or white, don't call me at night. But no, absolutely. I think having an exchange, and maybe some people might want a more serious pediatrician. They find some comfort in that, and then some people want someone who's going to show them that there's some humor in parenting also, because, it's not an exact science, and just someone to have a dialogue with. It's very important. So I would say one of the most important questions that we get asked is, what's the availability of the pediatrician? Is there a big wall? Meaning, when you have a question you ask, are you first being routed to an advice nurse who's going to try to answer your question? I think we distinguish ourselves a little bit at Village because we use a portal, and we don't use any advice nurses, anything after hours. Everything really is coming from your pediatrician. So you really feel like you're having a dialogue with that person and not with another level.
Yeah. And just to clarify for some parents who might not have seen these yet, what a portal is when a practice is on an electronic medical record, which is fantastic because it really gives us a way of storing your information, your baby's information in a very comprehensive fashion, and it lets us do a lot of follow-ups and tracking of referrals and labs and so on. But what a lot of electronic medical records have, and what we have here, is something called a portal, which is a way of you basically emailing the pediatrician. And there's a small additional step that you have to take to email because it needs to be in a privacy secure manner, meaning nobody can hack into your system and find out that your baby has a diaper rash or what have you. But honestly, for more important things, you don't want somebody being able to access your medical information. But it's a really easy way to just send a bunch of questions to us, and we can very quickly get into our portal and shoot an answer back. So if you're up at 2 in the morning and you're looking at your newborn and you're like, I think her color is funny, or her toes seem to be bluish when she nurses, all those little things that come up, just put them down in the portal, and then whenever Nikki and I or our associates are available, we can easily log into the portal and answer them. And sometimes I'm up at 5 in the morning answering messages because
people are always amazed at the times that we answer. Yeah. We're all up at odd hours.
Yeah. And that's actually incredible because that's quite rare. I mean, I certainly don't get that in my pediatrician.
And
so
we don't do emergencies through the portal, but we use something called Google Voice, which texts the pediatrician on call, and we just assign it each night for whichever pediatrician is on call. And then you quickly get an answer back. So like if your baby's lips are blue, like that's not something you're going to put in the portal, you're going to call, and then one of the physicians calls you right back. And that's where we don't use the advice lines that come out of Denver and Cleveland Children's. And we find it just cuts out the middleman. Like, I don't want anybody else getting involved. I know you, I know your family. I know if you're someone who worries a lot or someone who never calls me, so if you call and your baby's lips are blue and you've never called, like, I'm going to wake up a little more.
Absolutely, and I think that is actually one of the most valuable parts of the practice. We do have patients who love that, or parents who love that they're talking to the doctor. And again, because we're not huge, we really know most of the kids pretty well once they've been here a few times. And if we don't, we can very easily log into our system at home as well and say, oh yeah, they have had a whole bunch of ear infections, or they did have this funny little episode a few months ago, which is similar to what's going on now, and we can see what somebody else might have written about it. So I do think it's nice to be able to get a hold of your pediatrician as easily as possible.
Yeah, absolutely. And I think as well, there's definitely a benefit to maybe not going to a huge practice, because I think you do lose that personal, exactly like you just said, Nikki, the ability to know, actually, I've never spoken to him, she's been with us for 3 years.
Right.
You know, so this must actually be an emergency. I'm going to call her back straight away.
Yeah, no, absolutely.
And there, you know, some of the bigger practices will sometimes offer various types of amenities. You know, they may be open from 6 in the morning till 9 at night. But honestly, it's rare that you're going to be running out with your baby at 6 in the morning or 9 at night. A lot of those types of issues we can take care of with a phone call. And the other thing that I find is, you know, and I was on call this past weekend, so I had a couple of things I was thinking about. You know, there are a lot of emergency and urgent care facilities in the area, and more medicine seems to be going to a, you know, kind of Band-Aid approach. You get sick, you go somewhere and they patch it up, and then you get sick again and you go somewhere else and they patch it up. And for children, we really want a medical home for those kids. We want to be able to track what's going on, whether it's illness or well-child development. So we really try and be a comprehensive home. And if somebody's calling me on the weekends, it's very rare that we would actually ever have them go to a place like an urgent care facility or an emergency room, because we're able to provide most of the care for a child in most emergencies here. And if not, we can help coordinate that care on the outside. We know a lot of specialists who may come into their office and see a child and stitch a laceration, or in many cases we can really spare a trip. You know, a parent will call.
Yeah, all the time.
Yeah, you know, like they're 102, and do they need to go to the ER? We almost never. So we can really handle a lot of that directly, whereas some of the phone triage services have these very specific guidelines that they have to follow.
ER, and coughing more than this ER.
So, nice.
So do you think they should definitely be asking the question about hours? I think that sounds really important.
I think it's more about accessibility. I think that's kind of what Jay was pointing out. Yeah, it's not so much hours, but it's accessibility. So am I going to be able to reach you if I have an emergency? And are you going to give me guidance? And guidance aside from just go to the ER, which is what like a triage nurse might say. And I think convenience, like we've really built our model on wanting walk-ins every morning at 8:30. You don't need an appointment, you just show up. And also we do dispense certain medications because we know parents hate to go to the pharmacy. Like, it's nothing worse than having 2 kids with a bad cold and one of them has an ear infection and they're both crying and thinking about going to CVS. So we dispense, you know, Zofran, the nausea medicines, and amoxicillin.
And that way we know the patient has it. It's nice for us to know, okay, you know, kid has bad croup, we've got that first dose of steroid in them if they need it. And we know that the kid will take the amoxicillin and not spit it right back out. So.
Actually, that is a huge benefit. So you actually hold certain types of
emergency
medicines in the practice.
Yeah,
that's amazing.
Yeah,
that's amazing. And would you say that the fact that you're led by, I mean, when you look around the offices, this office, it's just made for children. I mean, I
gotta give Jen credit on that.
It is fabulous. Honestly, the first time Jessica and I walked in here, I was like, this is amazing. I'm a child inside, so I loved it.
Well, that's why we're all in this, right?
Yeah, I mean, it's you've got Kobe, the puppy dog, who's allowed to be taken for a walk. Dr. Kobe, yes. And just all the toys and the games and the colours, and I think that makes a huge difference as well to children.
It also makes for happier pediatricians. I mean, let's be honest. We have a Riverview.
We picked this location because we want to be happy too. But we really, it's very important to us that kids learn to enjoy coming here as much as they don't want to sometimes.
Hence the prize corner and the prize chest.
So we do, we have a lot of little doodads here. We do a lot of distraction medicine. So if your child needs a shot, they're going to be scared. I mean, I'm scared of shots. And that's, I think, part of where some of these ideas came from. Is I'm terrified of doctors. I'm terrified of shots. So we're going to try and make those experiences as easy as possible. And we also really try and do most of the services in the office. So, for example, blood draws. I'd much rather have a child here for a blood draw where I can distract them and use various desensitization
Watch
devices, and watch YouTube or blow bubbles, and they do great here, just because we're so child oriented.
Right. We give all our own immunizations also.
Yeah.
That's kind of like a personal goal of ours.
Yeah.
Who can get the least amount of crying throughout a day? Not that we're competitive.
Yeah. No, it's, the other problem with medicine these days is that everything is, because insurance limits payments, the model is moving towards bigger and bigger and bigger, and having everybody in the medical home perform a very specific role. So that the nurse will room the patient, and then the doctor will come in and do their fast little visit, and then send in another nurse to do shots, and somebody else to do this, somebody else to do that, because it's not necessarily always cost effective to have a physician who is at a higher training level do everything. But we're old-fashioned, or maybe I'm a little bit older, but but we like, in a sense, we're old-fashioned because we really prefer to do some of those tasks that might be considered below our level ourselves, because it's part of the experience. So
and getting the child comfortable,
and
joking while you're doing it.
Yeah. So that way they trust us, and it's a very different type of relationship when they know that, okay, they hate shots, but we have ways of getting them through it, and we know
shot
little
blockers
tricks.
and I would say maybe once a day we get a patient and the mom goes, I think he just wanted to come here.
Yeah. Oh, we have lots of patients. We hear that they drive past the office and like, I'm sick. And I love that. That's just that really warms our hearts. So.
Yeah.
Oh, that's great. Well, listen, thank you so much, ladies. This has been wonderful. So if we were to put it into, let's say, 3 to 4 questions that you think are the most important, give me those 3 to 4 questions.
Accessibility to your physician.
Yeah.
Convenience, respect for your time. Convenience and respect for your time are pretty similar. Meaning things like walk-in hours, and that patients get in and out quickly. All the screening, the developmental screening.
I think probably the one thing we didn't have time to touch on is education. How do you educate your patients? Because as a first-time parent, we no longer have communities where you have grandparents and parents around, and big family networks that can provide support. So how do first-time parents learn? And that's crucial.
That is crucial.
Yeah, so having an active website with a lot of information available, being able to accept Facebook. We post a lot of, if you look for Village PD on Facebook, we post almost daily.
We welcome anyone to like us, because then you read the articles if they interest you or not, whether you're our patients or not. We're just about educating the community.
Yeah. That and just having a little time in the rooms, a little extra time just to say, you know what, this is what they have, this is what you can expect, this is when you should call, this is when you shouldn't call, and that's...
I think one of the really important things that I think with you girls as well is I can imagine that you are happy to actually sit with the parent and spend time with them, especially if they're worried and if they're upset. No, you actually sit and have a conversation rather than, what is it? Okay, jot it down. Brilliant. Okay, someone else is coming in. Right, off you go, off you go, off you go. You know,
that's
a personal relationship.
Went into this for.
Yeah.
You know, we started 20 years ago, and it was a little different then, and we wanted to preserve what we went into this for.
So I think it's really important as a parent to know as well, go on your instinct. If you meet a doctor and you think, this person doesn't fill me with warmth, they're not going to do that to your child.
And the other thing,
you know, they're not going to fill your child with like good feelings.
Way too much of us with a newborn who doesn't have that kind of relationship.
But it's like anything in life. Like there's nothing that can be done that can't be undone. If you're unhappy, then you go interview other people and switch. Like, you know, people do this kind of thing all the time. So.
Yeah. I'll be switching.
Seriously?
But we're not competitive. We're like basketball.
I'm sold. I actually almost brought my 2-year-old in today. He had a really snotty cold, and I thought, I bet you're going to be thinking, bring your child in. I thought, well, you're a pediatrician, of course you're not going to mind.
But even within the practice, sometimes switch between people who switch between Gemini, and that's okay. Like, we have different styles.
Yeah.
That's okay.
So if someone was to come in, would they always see Dr. Jen, or they would always see you,
Almost
Dr. Nikki?
I mean, for well visits, yes.
Yeah.
But, you know, if Jen's not here on a day, I'm going to see you. You're going to know me too.
Yeah.
Like, you're going to think
and we're very careful amongst the 4 physicians here that we sit down and we talk regularly and say, okay, how are we treating X? How are we treating Y?
Yeah.
So that I'm not saying, never use an antibiotic for this, and Nikki's like, we should always use an antibiotic.
Benadryl, right? No, you don't want inconsistency.
No, we're
very similar.
And I let
but different.
Parents and kids are happy to sort of bump back and forth. It's like whatever, time is more convenient, and that's fine too.
Yeah.
Would you ladies be happy to just jot down a few things for us so we can post it for everyone? Maybe just like a list of those 3 or 4 questions. Would you be happy to do that? So we'll make sure that you guys have got a copy of that. If you want to come onto the Facebook page, we'll make sure that the ladies are putting those down for us.
Yeah. You want it now or you want it later?
Oh, look at her, she's so action
No,
oriented.
we can't start it unless we just do it, right? That's the only way we open the business together.
That's
is
Jessica.
because we had a 3rd woman and she wasn't returning emails. We're like, either you're in or you're out.
Yeah, I love it.
I send an email, Jen's back to me within 5 minutes.
But you know, that's what a parent wants. I think, to be honest, a parent wants someone, they ask you a question, they want an answer. Because as a parent, not knowing is the stressful part, I think.
Right.
So having someone that basically says, yes, I think it's this, and let's deal with it.
Right,
You
and
know,
it
let's
doesn't
work
get
with it.
better. Like we were, young parents. We know if they're calling about their baby's first fever, maybe that doesn't feel like an emergency to me, but I know they're sitting there worried. So why wait to call them back? Just call them back. You know,
Yeah,
they're going to feel
right.
better, or text them back if you're.
Well, ladies, this has been wonderful. Thank you so much.
No, thank you for coming.
Thank you for listening.
Thank you. It's
And
fun. We like being on TV.
we'll post those questions. Thanks, everyone.
Thanks.